The term dermatome is a combination of two Greek words, derma meaning skin and tome meaning cutting or thin segment. Dermatomes are areas of skin whose sensory distribution is innervated by the afferent nerve fibers from the dorsal root of specific single spinal nerve root, which is that portion of the peripheral nerve that connects the nerve to the spinal cord. Dermatome testing involves assessing sensory nerve function by examining specific areas of skin innervated by different spinal nerves. It helps identify potential nerve damage or neurological issues by checking for abnormalities in sensations within these defined regions. Now, common causes of issues in dermatomes include nerve compression or irritation due to conditions like herniated disc, spinal stenosis, or injuries. Diseases such as diabetes, infections, autoimmune disorders can also affect nerve function and lead to dermatomal problems. Additionally, trauma or pressure on the nerves like in carpal tunnel syndrome may contribute to dermatomal issues. Now let's talk about the technique of dermatomal testing. So dermatome testing involves using a pin or cotton wool. Instruct the patient to close their eyes, then provide feedback on stimuli. Perform tests on specific dermatomes and compare bilaterally. Now there are two types of tests that are conducted in this dermatome testing. So first is by the light touch, and that is basically a light touch test, and the other one is pin prick test. In light touch test, dab cotton wool on a skin area for light touch sensation. While in the pin prick test, gently touch the skin with a pin and ask if it feels sharp or blunt. During the systems review, have the patient describe sensory systems, pattern or distribution like tingling, numbness, diminished or absent sensation to guide the examination and identify involved dermatomes and nerves. Now let's move towards the main topic of our video, that is demonstration of dermatomal testing. So welcome back to my channel. You are watching Medico's Guide, and let's begin with our topic. First we are gonna take start from the upper limb. So here this one is C5 and it is located laterally in the arm, and now this is C6 that is located in the lateral side of forearm, and it is continuous distally till the thumb and the index finger. Now this is C7 and it supplies the middle finger. So again, anteriorly and posteriorly we are assessing this dermatome. Now we are going to assess C8. So it supplies the little finger, which is a pinky finger, and the ring finger. And now we have T1, that is along the medial side of the forearm. Then T2 supplies the medial side of arm. Now we are going to assess the dermatomes of lower limb. So first we have L1, that is around inguinal ligament area. Then L2 is at the interior of the thigh. Then L3 is around the knee. Now L4 dermatome is around the anteromedial aspect of the lower limb, as well as it also supplies medial malleolus. Now this is L5 dermatome that supplies anterolateral aspect of lower limb as well as front of the foot. Now bring the patient in prone lying position. So first dermatome that we are going to assess here is S1, and this supplies the posterior aspect of lower limb as well as the heel area. Now the S2 supplies posterior aspect of the thigh, and that's all.